pleased to bring to you this Wednesday Lunch and Learn. Our sponsors today are Kaiser Permanente, Humana, and Integrity Insurance. We also have the Centers for Medicare and Medicaid Services joining us today at this event. First thing I'd like to do is to give you a little bit of information on how Hop-In, which is the navigation bar that we're working, or program that we're working with today. So the first thing you see over here on the left is a big red box with a 1 below it. And at the top is a little circle wheel kind of thing. Don't worry about that. That is just the logo for Hop-In. The next thing we have is a little house, and that is the reception area. That's where we will start. The second little icon there is a camera, and that is the stage, and that is where we will go as soon as we finish with this introduction. So that will go live, and it will be blue, and you'll know that you are on the stage. When I finish talking, I invite you to go to the third little box down here, which looks kind of like a tent, and it says Expo under it. And that's where our sponsors will be, as well as the Centers for Medicare and Medicaid Services, as well as I will be manning the the booth for the Colorado Gerontological Society. So if you have any questions that you would like to ask after this event, you can just see me there. Many of you have been to our in-person events, and I know that one of the valuable things you find is the ability to talk to the presenter in more detail. The second thing we have over here on the right is we have a big 2 with another box, and there is a chat there as well as polls. And so the chat is how you can put questions into the chat, or you can get notices or information while we are presenting. And if you want to write a question in or make a comment, you put that in the box down here where there's a number 3. In addition to that, there's some polls up here, which you might want to just click on during the event. There's a couple of things there. One is, I think there's a question about what your zip code is. And then there's a couple of questions about, did you find this particular session helpful? So as you can see now, I've gone to the next slide, and the little blue button over here, the camera is blue, and we are in the stage area. And this is where I will be talking from momentarily. And then the third one, which is this little tent looking thing, says Expo. And that is where we will go once I finish making the presentation. So the first little box here, a rectangle, is us, the Colorado Gerontological Society. The next one is the Centers for Medicare and Medicaid Services. The next one is Kaiser. And below that, there will be a box for Integrity Insurance, and there will be one for Humana. The inside of the booth looks like this, unless somebody is sitting there. And so after the presentation, when I join you in this exhibit booth, you'll be able to see me. You'll be able to listen to any of the presentations that I have. You'll also see over here on the right, there is a 2. And now this word is booth up here, and it says chat. So basically, if you click that chat, you'll be able to talk to me while I am doing a presentation in this booth. There's also a way in here that you can click, and I can let you in, and I can actually see and talk to you. The other thing is that over here on this particular stage or booth while we're talking, if you want any special information, such as a goodie bag, you would like a toolkit, you want more information, you want to just take advantage of some of our other opportunities, if you click in there and tell us what you want, leave us your name and telephone number, we'll send you an email and we'll figure it out. So with that as an introduction, I'd like to go ahead and get started to our Medicare Wednesday Lunch and Learns. So the first thing we'll talk a little bit about is Medicare Part A, which is inpatient care, hospitals and rehab, plus home care and hospice. The Medicare Part A deductible period is basically every 60 days. We expect that the deductible for 2021 will be around $1,452. After you pay that $1,452, then the first days 1 through 60 are at no cost to you under Medicare if you are in the hospital. Days 61 through 90 are projected to be about $363 a day. And after day 91, you would go into your lifetime reserve days, and that is projected to be around $726. Medicare Part A is free for people who have paid into Social Security. So what we wanted to do this morning a little bit, or today, is to talk about COVID-19 and hospitalizations. And Medicare will pay for all medically necessary hospitalizations related to COVID. So if you get sick, you do not have to worry. You will be covered. Now, you do still have to pay the deductibles. You have to pay the co-pays and the co-insurance. So if you go to the hospital under straight Medicare and you have a Medicare supplement, then you would still have to pay that Part A deductible of around $1,450. And if you have a Medicare supplement, they will pay that. Similarly, if you have any other co-pays, or if you had to go to a skilled rehab facility, you would have to pay the daily charges after day 21. Another important waiver, if you will, and most of these for the next few slides are going to be waivers or things that normally Medicare would require of hospitals or of other healthcare providers. So there's a provision that says that if you show up at a hospital and you have an emergency, regardless of whether or not you can pay for it, the hospital has to treat you. During COVID-19, hospitals do not have to treat you at that emergency room. They can if you show up with COVID-19 or you suspect you might have it. They can ask you to go to a sister facility or another offsite facility to protect the other patients that are in their hospital. They still have to treat you, but they don't necessarily have to treat you in that particular emergency room where you might be initially presenting. Another thing that they have done is made it much easier for doctors and other healthcare providers to provide verbal orders and then to sign them later. A really big concern during the COVID-19 has been the whole use of advanced directives. This is known as the Patient Self-Determination Act. And under normal times, hospitals are required to ask you if you have a medical power of attorney. And if you do not, then they will usually have you sign one there on the spot. The requirement to do that has been basically waived, although there has been a lot of effort in the state of Colorado to try to get all older adults to fill out advanced directives. In addition to that, we have also seen where on the bedside, sometimes physicians have started to have conversations, both with the patient as well as with powers of attorney, to see if the medical power of attorney that has been presented is in fact the has the authority, and the advanced directives that have been provided is what the individual wants in this situation. And a skilled rehab stay, again, normally under normal times, there has to be a 3-day inpatient hospital stay for you to be able to get skilled rehab or home care. That has been waived during the pandemic. But you could be in the hospital only 2 midnights and be transferred to a skilled nursing facility for skilled services, and you would be eligible. The costs under a skilled rehab facility are $0 for days 1 through 20. They're projected to be $181.50 per day for days 21 through 100. And if you have to stay more than 100 days, then Medicare does not cover that. Again, if you have a Medicare supplement, this daily rate would be covered. If you have a Medicare Advantage, you would be responsible for those costs. Another change or requirement is in long-term care facilities and skilled nursing, which is basically what we just said, a waiver of the 3-day prior hospitalization. Another waiver that the federal government and Medicare have put into place is the PASAR. So an individual cannot be admitted to a nursing home just because they need mental health services. They also need to have long-term care services. And in order to be admitted, if you have certain conditions or certain medications, you have to have this PASAR. That has been waived for the moment. Many of you are familiar with the requirements in skilled nursing facilities in which residents have basically been restricted from having in-person meetings, both with each other as well as with the outside community. And if they have been allowed any type of activities outside of their room, they have had to practice social distancing and in groups of no more than 10. The executive order for Colorado even prevents that. Another requirement that happened is that, as I said a moment ago, the requirement that doctors and families visit in person has also been put into place. So basically, it allows for nursing homes to implement the requirement that families cannot visit. They did also put a waiver into place that physicians and non-physician practitioners could not go into nursing homes. This has been lifted to some extent, but again, it still has to be pretty medically necessary. Another requirement that CMS waived is basically you cannot move individuals into a room, or you cannot change roommates without proper notice. What this requirement allows is that if one or the other of a roommate have COVID or they're suspected with COVID, then they can be moved out of that room to protect the health and safety of the other resident. In terms of resident transfer and discharge, again, CMS waived the requirement so that long-term care facilities or nursing homes can transfer and discharge residents between facilities. And they can do this if they suspect either respiratory infections or any time of COVID-19. This also gives them the authority to quarantine somebody for 14 days. On the home health side, we have waived the 3-day inpatient hospital stay there as well, providing you need skilled services. And the individual still has to be homebound. Home care services are made available at no cost. Under ESRD or kidney dialysis, we've waived the requirements related to how frequently patients need to be assessed. Again, in the interest of protecting both the older adult who is extremely vulnerable, as well as healthcare professionals who are working with them. Care plans also can be done after the fact, as opposed to before the fact, as well as monitoring is occurring on a less frequent basis. Medicare Part B. So B basically usually covers labs, x-rays, and those kinds of things. And there've been a couple of major things to know about. So if you have a COVID-19 lab test, that again is going to be covered by your Part B benefit. And at this point in time, if you have Medicare, then that is at no cost to you. Similarly, if you have a COVID-19 antibody test that is approved by the FDA, then that also is available to you at no cost. If you have a Medicare Advantage, you may be subject to their copays and deductibles. A really, really big change that Medicare made for telehealth is that they have expanded these services to all kinds of settings, as well as to all kinds of patients. So the requirement that out-of-state practitioners can be licensed in the state when they're providing services, they've waived that requirement. So for example, if I have a nursing license in Arizona, I come to Colorado, I can practice without having to go through all the licensure. This has been really helpful in terms of being able to improve and expand our workforce. On the telehealth side of things, we're now allowing telehealth, which basically is two-way communication, whether that is with a telephone, a tablet, or a computer. We're allowing it for office visits, for psychotherapy, for consultations, for diagnosis and evaluation of things such as stroke, substance abuse disorder, and some other mental health disorders. If you do have a telehealth visit, you do have to pay the deductible, which for 2012 is projected to be $2021 is projected to be $212, and you do have to pay the 20% copay. On a Medicare Advantage plan, most likely, rather than having your Medicare supplement pay this 20% or Medicaid, you may have to pay the copay. Another thing that virtual or telehealth is allowing is virtual check-ins. And basically this is a brief communication follow-up with your doctor. And again, that is usually done by phone or an audio visit. It can even be done through text messages and emails, or it can be done through the patient portal. In previously, basically when these kinds of interactions have occurred with patients, the doctors have not been reimbursed. So under COVID-19, to prevent, again, as much exposure as possible, these things can be done via some type of electronic means. Virtual check-ins are subject to the Part B deductible and the 20% copay. If you want to do virtual check-ins, call up your doctor or your other practitioner and have them start setting that process up. If you were seen in the doctor's office in the past 7 days, you cannot do a virtual check-in for that purpose. And you cannot be told by your doctor that you have to come in within the next 24 hours for a follow-up. E-visits, the doctor now can charge for an electronic visit, very much like they charge for an office visit. And this again can be done either via text or voice. The kinds of practitioners that can be billed include your doctor, the nurse practitioner, physician assistants, any social workers, psychologists, therapists. So anybody like that can bill for e-visits. In-person healthcare facilities, providers and facilities can also use telehealth to reduce the in-person visits for non-emergency or non-COVID related care. So let's say that I am in a skilled rehab facility or a skilled nursing facility, or an assisted living, and I need, I'm experiencing some like gastrointestinal or GI discomfort, then the provider can see me via telehealth. Providers are also, if you go to visit somebody, they're being asked to do as much as possible with social distancing. So they might ask you to wait in your car. They may have different people using different entrances, checking temperatures, keeping people out of waiting rooms, all of those kinds of things, wearing face coverings and social distancing. Durable medical equipment is allowing these contractors to also waive the replacement requirements for face-to-face visits by the doctors, new physician orders. So if somebody calls the DME provider and says the brake on my wheelchair is broken, the DME provider can just send out a new one. In terms of Medicare supplements or Medigap, basically the question always is, will my Medicare supplement pay? And the answer is always. If Medicare approves the payment for the procedure, then the Medicare supplement has to pay. In Medicare Advantage or Part C, the biggest thing is that all Medicare Advantage plans have to follow the basic Medicare requirements. So all of the things that we talked about in the previous slides, all of those are required and Medicare Advantage plans to actually offer to you. In addition to that, they are able to waive or relax all of their prior authorization requirements, again, in an attempt to get services to you without a lot of exposure. On the Part D side, which is prescription drugs, there have been two main requirements. One is that almost all prescription drugs can now be refilled on a 90-day supply. That again reduces the amount of exposure that the older adult has as you have to go to the pharmacy, as well as it reduces the exposure for critical healthcare workers, i.e. the pharmacist, and or if your pharmacy is in a grocery store, it reduces their exposure. If you're using a long-term care pharmacy, such as in a facility, again, that reduces their exposure. Very, very new, and much to my surprise, they are also allowing the mailing of narcotics, again, to reduce exposure and having people come into their facilities. So if you needed help or you had questions about Medicare and COVID-19, where do you go for help? What kinds of things are available? So you can request a goodie bag if you would like. You can send us an email at cogs@senioranswers.org. Put in your name, address, and phone number, and we'll send you that information. Has much of the same information in it that you would get if you attended an in-person Medicare Monday event. You can also get some additional information on Medicare. If you drive by Holly Creek at 5500 East Peakview in Centennial on November the 2nd, the 9th, or the 16th, or you can come by our office at the Colorado Gerontological Society, which is at 1129 Pennsylvania here in Denver. In terms of a Medicare toolkit, we can offer you lots of support if you would like, and it could be around Medicare and COVID, or it can be around general Medicare kinds of questions and support. So if you have general questions about your coverage, if you're new to Medicare, we're actually doing a separate section on October the 26th, and that will repeat again on November the 9th. That is specifically designed for individuals who are new to Medicare. We can also help you if you're looking to change plans, either from an original Medicare and Medicare supplement to a Medicare Advantage, or if you're having questions about which Part D plan you should purchase. We also have some expertise, and if you're having trouble or you're not currently qualified, or you want to see if you're qualified for help paying your Medicare Part B and your Part D premiums, as well as some of the copays, we'd be happy to help you out. If you're having trouble with Medicare.gov on the plan finder and you're trying to figure out what the most economic prescription drug plan is for you, feel free to give us a call. We also have access to the medication management counseling support through the University of Colorado School of Pharmacy, and they will do drug reviews. They'll look at drug interactions. They'll take a look at what drugs you currently have, help you to identify new prescription drug plans. We have limited appointments. So there is one on October 21st. There's also several on November 4th and November 5th. And lastly, in this toolkit, we have listed a number of resources with the websites. So there's the Medicare.gov site, the Medicare Planner, which is the Plan Finder, which is where you can get help figuring out your prescription drugs. MyMedicare.gov is the site at Medicare.gov in which you put your own personal information and it stores it there, and then you can always keep up with your costs, what immunizations you've had, what screenings you've had, what prescription drugs you've had. So it's a kind of a handy little tool. There's also an app that you can put on your telephone if you want to use that to check on those kinds of things if you're out and about. The Colorado Department of Health Insurance, or Division of Insurance, has also printed their annual Medicare drug insurance newspaper, which many of you pick up at our in-person events. And if you would like an electronic copy, here's the link. And if you would like to have a copy mailed to you, please feel free to give us a call. If you're looking for a complete list of the Medicare supplements and Medicare Advantage plans, you can get those at Medicare.gov. The following companies are sponsors of today's event. So Humana, Integrity, Kaiser Permanente, and Cigna have helped to bring this event to you. And now that we are coming to the end of this presentation, I will, in a few moments after I leave this stage, I will go to the expo, and you can visit representatives from the companies who are our sponsors, or our friends at the Centers for Medicare and Medicaid Services, or myself in the expo hall. Remember that you just get there by clicking on that little tent looking thing on the left-hand side of your screen, and it's in box number 1, and down at the bottom it says Expo. If you click on it, why the blue light should come on. Thank you for joining us, and if you have any questions regarding Medicare prescription drugs, Medicare Advantage, please feel free to give us a call. Our counselors are standing by. Also, if you would like a goodie bag, or if you would like some more Medicare resources on the porch, you can request those by putting your name and address and in the chat, or not in the chat box. Please put it in the email, and that email should go to cogs@senioranswers.org. Again, thank you for your attention, and we look forward to sharing more with you about Medicare over the next few weeks.